Hello, everyone. Welcome to our live session on the revolutionary advancements in general surgery through the integration of minimally invasive technology. Today, we have the honor of bringing together leading experts in the field who will unravel the remarkable benefits and cutting edge techniques that have transformed the landscape of surgical interventions. Our panelists will enumerate the advantages of these techniques, discussing their profound impact on patient outcomes, reduced hospital stay, fastest recovery time, and enhanced overall well being. So, allow me to introduce them. They both possess a wealth of knowledge and expertise in the realm of minimally invasive general surgeries. So, first we have Dr. Rajat Saxena, a highly skilled and accomplished surgeon with an extensive experience of more than 25 years, specializing in laparoscopic and thoracic surgeries. With an extensive track record of success in handling complex cases, Dr. Saksena's expertise spans a wide range of clinical interest, including open and laparoscopic surgery, colectomy, appendectomy, hernia repairs, and intestinal malignancy. He is currently practicing at Metro Hospital and Heart Institute in Noida Sector 11 and Metro Hospital and Cancer Institute in Preet Vihar. Dr. Saksena's expertise and experience have benefited numerous patients seeking surgical treatments. So joining Dr. Saxena is Dr. Adarsh Kumar Chauhan, a distinguished general surgeon in the Department of GI and Minimally Invasive Surgery at Metro Hospital, Noida. He's holding MS and MCH degrees. Dr. Chauhan has gained over more than 10 years of experience in the field of laparoscopic and general surgery. His areas of expertise, including laparoscopic minimally invasive surgery for gallstone, hernia, bariatric surgery, gastrointestinal, and other disorders such as piles, fistula, fissure, and other general procedures. Together, these distinguished panelists possess a deep understanding of the transformative power of minimally invasive techniques in general surgery. Their collective knowledge, experience, and passion for improving patient care will undoubtedly enrich our exploration of this rapid evolving field. As we delve into the transformative world of general surgery, we encourage you to actively participate by posing your questions to our esteemed panelists. Let's unravel the extraordinary potential of minimally invasive technology in general surgeries and gain a deeper understanding of how it is revolutionizing the landscape of surgical care. So, my first question to Dr. Rajat. So, what is minimally invasive surgery and how does it differ from the traditional one?
Now, minimal invasive surgery, as the word explains, it is minimally invasive. Minimally invasive means that when we are operating any patient by minimally invasive surgery, we are not making big incisions in the abdomen or in the chest of the patient. We are making small holes and through which we put our instruments inside the abdomen or inside the chest and operate the patient through those small holes only. Generally, we make about 3 to 4 holes in the abdomen or chest, and whatever surgery which can be done by open technique is done by minimally invasive technique through these small holes.
Thank you, sir. Dr. Adarsh. So, what are the main benefits of minimally invasive techniques in general surgery, sir?
In basically the benefits are the hospital stay is very less, the pain is very less, and the cost effective is less. The minimum complications are there in a minimal invasive surgeries, and short period of hospital stay and early resumption of work to the patient, and as compared to open surgery, the complication is very less.
Thank you, sir. And Dr. Rajat, sir, can you explain the specific steps involved in a minimally invasive procedure compared to a traditional surgery?
Now, okay, so in traditional surgery, like in traditional cholecystectomy, we used to make about 6 inches incision on the right side of the patient upper abdomen and open the skin, then open the muscles, and then go into abdomen and take out the gallbladder. But in minimally invasive surgery, we are making 4 small holes, one near the navel and other 3 on side of the abdomen. And we, from the navel, we introduce a telescope, a camera to look inside, and other 3 incisions, we put our instruments through ports and proceed with the surgery similar to the open surgery. So whatever we used to do with the open technique is now being done with minimal invasive approach. The benefits, as Dr. Adarsh has also told you, that the post-op complications are less, the hospital stay is reduced. It is very cost effective because the patient is able to join his work back early. And it is cosmetically very good because patient is not having big incisions. So cosmetically also it is beneficial.
Thank you, sir. Dr. Adarsh, so what types of conditions or surgeries are commonly performed using minimally invasive techniques?
In minimal invasive surgeries, we can do all the operations by minimal invasive surgeries. Those patients are fit for general anesthesia. Like we can not do minimal invasive surgeries in patient that
Sorry to interrupt you, sir, but there is some echo from your side, so I guess आपकी आवाज जो है वो properly नहीं आ रही. So if you can re-answer that question, answer, sir.
we can do all the abdominal surgeries scopically. Those patients are fit for general anesthesias, except like in patient those are having the pulmonary disease, like those have the cerebral disease, like cardiac disease, pulmonary disease, not fit for general anesthesia. Rest are according. I'm audible.
Yeah, you are audible, sir.
We can do all the surgeries except this. Those are obese patient, morbid obese patient. Those are ascites. Those are having the pulmonary complications. Those are the coagulopathy. We can do rest of the operation by laparoscopy.
Thank you, sir. Dr.
Yeah,
Rajat,
I would
sir.
like.
Yeah, please.
Yeah, can I add? All the procedures, most of the procedures which could be done by open technique can be done by laparoscopy, like gallbladder surgery, appendix, hernias, inguinal hernias, incisional hernias, and to be specifically, surgeries which are difficult to do by open technique can be done very well by laparoscopic technique, like fundoplication and bariatric surgery earlier, which was difficult to do with because there are certain areas of the abdomen which is difficult to reach by open technique where easily by laparoscopic technique with the telescope we can reach the hidden areas of the abdomen. So some surgeries which were difficult by open technique have become easier by laparoscopic technique. Similarly, I do a lot of thoracic surgeries, lung surgeries, which were difficult to do by open technique or used to take more time by open technique are being done by thoracoscopic techniques, which is minimally.
Thank you, sir. Next question to you. So, are there any risks or potential complications associated with minimally invasive surgery, and how do they compare to that traditional one?
The risk and complications of open surgery and minimally invasive surgery are more or less similar. However, the complication rate is less in minimally invasive surgery because post-operative pain is less. So there is a particular condition called as post-operative atelectasis where the patient is not able to breathe properly. So after abdominal surgery, when there is a big incision, so what happens is the patient develops post-operative pneumonitis because deep breathing is not there. So these complications they are nullified by laparoscopic surgery. But any complication which can happen during open surgery can happen in minimally invasive. But minimally invasive surgery is as safe as open surgery, maybe even better.
Thank you, sir. Dr. Adarsh, so how does the recovery process differ for patients undergoing minimally invasive surgeries compared to the traditional one?
As we Dr. Rajat previously says that traditional there's a long incision like 6 to 15 centimeter. The recovery rate is very prolonged in a traditional surgeries, but in a laparoscopy surgeries we have to do only a keyhole size incisions like a 10 or a 5 Though the scar and the recovery surgeries are faster, as well as the pain is less in a laparoscopy surgeries as compared to the traditional surgery, and early resumption of the work is also there in a minimal assistive surgeries, and the blood loss is very less in a minimal assistive surgeries, and the hospital stay and the scar is very less in a laparoscopy surgeries.
Thank you, sir. Dr. Rajat, so can you explain the equipments and instruments used in minimally invasive procedures and how do they contribute to the better outcomes?
So in minimally invasive surgery, we require specific instruments which with which we operate on the patient. So the main instrument used is a telescope. It is about 12 to 14 inches long. It is like like a camera, and with the telescope we attach a camera, and with the camera the image is transferred onto a monitor, with which we can see the image of the patient inside the abdomen on the monitor, and the image is enlarged. So even minutest of details can be easily visible through this telescope and the camera on the screen. And we operate by seeing on the screen. And the other instruments like the open instruments, they are modified for laparoscopic surgery. They are about 12 to 14 inches long, which we insert into the abdomen. And all the techniques of open surgery are mimicked in the traditional minimally invasive surgery. So everybody has to understand that we are not doing anything different than open. Only what we are doing is we are using certain different instruments which are longer than normal and not making big incisions into the patient. The procedure done open or laparoscopically, like in a gallbladder surgery, if we have to remove the gallbladder through open technique, we remove it through laparoscopic technique. Or appendicectomy, if we are doing through open technique, in laparoscopic surgery, we remove the appendix only. So the nature of surgery is same, only the access is different so that it is beneficial to the patient.
Thank you, sir. Dr. Adarsh, sir, are there any specific criteria or patient factors that determine whether a person is suitable for minimally invasive surgeries?
We can do all the laparoscopy procedures in general anesthesia. Like open surgery and laparoscopy surgeries are almost same. Those do laparoscopy surgery as well as in a general surgeon, like open surgery as well as. And the criteria is not much different. Like those are fit for open surgeries. We can do in a laparoscopy surgery also. Like a morbid obesity patient is not preferred in a laparoscopy surgery because of the access of the instrument and the length of the instrument. We do a bariatric surgeries in those patients. Those are have a coagulopathy. We not prefer not to do a laparoscopy surgery due to the bleeding chances of bleeding in that patient. Those patients are fit for the anesthesia. We can do in those patients the laparoscopy surgeries.
Okay, thank you, sir. Dr. Rajat, so what advancements or innovation have been made in minimally invasive techniques in recent years?
See, there are a lot of advancements which have come over. Like any procedure which develops over time. See, laparoscopic cholecystectomy came in early 90s. So it's been now nearly 30 years we have been doing laparoscopic or minimally invasive surgeries. Now the technique has advanced from 4 port to 3 port surgeries. Then we have, advancement in the endovision system. Endovision system is the technique by which we, telescope and camera by which we see inside the abdomen. So earlier it was standard definition, now it is high definition, and even 4K telescopes and cameras and monitors are there by which we can see the minutest details in the patient. And now the latest advancement is a 3D camera and a telescope in which we can do have a 3D vision in the patient, and it is very easy to do pelvic, like lower abdomen surgery is very good if we do with a 3D telescope. And similarly, the newest advancement is a robot. Now, the robotics have come up in a very big way in minimally invasive surgery. So, in robotics, we are making similar holes into the patient, maybe even smaller, and uh, the surgery is done by the surgeon sitting on a console away from the patient. And we put in the instruments, and there are robotic arms which are obviously controlled by the surgeon, but the movements are very precise. So surgeries which are difficult to do with minimally invasive, like suturing inside the abdomen, it is very easier to do with robotics. So robotics is the latest advancement which has come up in minimally invasive surgery.
Thank you, sir. So, Dr. Adarsh, so can you share any stories or patient testimonial regarding minimal invasive surgeries?
Yeah, and generally the Metro Hospital, we do a 4 to 5 laparoscopy surgery by the Dr. Rajat and as well as our team. So the almost all the patients are discharged with the next day with a very well recovery. Um there is no as such the contraindication or like complication are happen in our hospital. All the patients are recover very well. Will be the discharge with the next day, and early resumption of work also. That after surgery, after 2 to 3 days, patient go to his work and do everything by himself.
Okay, so
Yeah,
my last, yeah, yes, sir.
yeah, I would like to share a recent surgery which I have done. A 82-year-old male, a very high risk cardiac patient with multiple cardiac problems, and he had stones in his common bile duct which were removed earlier by ERCP, and patient had to undergo a laparoscopy. I did a laparoscopic cholecystectomy. So now you can understand a 82-year-old male with all the difficulties with heart problems and cardiac problems and other problems, and we were successfully able to do a laparoscopic cholecystectomy, although it was a very difficult cholecystectomy, and patient is having a uneventful recovery. So minimally invasive surgery in this manner is very beneficial for high risk patients and patients who are old, because the recovery is faster and the normal hemostasis of the body like physiology is better maintained by minimally invasive surgery rather than open surgery.
Thank you, sir. Sir, my last question to you, as minimally invasive techniques, continue to evolve, what do you think that what is the future of general surgery, and how do you anticipate it will impact patient cares and outcomes?
Minimally invasive surgery has come up in a very big way in general surgery, and I think every general surgeon should be trained in minimally invasive techniques because it is part and parcel of everyday works for a general surgeon. But we have to be versed with the open technique also, because sometimes when minimally invasive surgery is not going to work for the patient, then we have to do with open technique. I could say that although minimally invasive surgery has come up in a very, very big way, open surgery is still not obsolete. But however, all general surgeons have to be trained and have to have experience in minimally invasive surgery because it is beneficial for the patient in a very big way.
Thank you, sir. So there are a few questions on our chat box that I would want to take. So here is the first question that you can see on your screen. It's, hi, I am 35 years having multiple gallstone of 5 to 11 mm. Did stenting due to obstruction in bile duct. Do not want to remove the gallbladder. So Dr. Rajat.
Yeah, so one thing, Mr. Inder, you have to understand that the origin of bile duct stones is the gallbladder. So if your um, by stenting your common bile duct stones have been removed and you don't remove the gallbladder, there are chances that the stones will reform because the problem lies within the gallbladder. Gallbladder is the source of these stones. So anyway, you have to remove the source, so it is mandatory that you get your gallbladder removed. There is no question regarding that you have to get your gallbladder removed. Otherwise, the stones will reform and then they will again slip into the common bile duct, and you will have to get the stones removed again.
Thank you, sir. There is another question. Uh, Hi, my father is suffering with hernia. Doctor suggested to go with open surgery. What is the best method for this surgery, open or laparoscopic?
As do a laparoscopy, the age of the patient, can you mention?
No, sir, he hasn't mentioned, but we can say considering he must be around 60 plus because he's a father of a.
And this age group we prefer the laparoscopy surgery due to the age is 60 and the hospital stay is very less and the complication is very less. Yeah, open surgery the scar is very large. The chances of infection, chances of the sepsis is higher in open surgery as compared to the laparoscopy surgery. Laparoscopy surgery we do the with a three instruments. and 3 small incisions, and we do the laparoscopy hernia repair surgery with minimal blood loss, with minimal chances of infection. So, in my opinion, we do a laparoscopy hernia repair surgery in this patient.
Thank you, sir. So, Dr. Rajat, there is another question by Inder. He's asking, what are the symptoms of inguinal hernia mesh shrinkage, and which type of mesh is suitable for inguinal hernia surgery and which leads to no shrinkage?
You know, all meshes they shrink to about 10 to 15% of their original size. Okay, that is the normal physiological phenomena. So that is why in our inguinal hernia surgery, we are using a big mesh in laparoscopic technique, which is about 12 centimeters by 15 centimeters in size, so that it covers all the potential hernia defects, the direct hernia, the indirect hernia, as well as the femoral hernia. So whenever you are using
Uh,
a mesh, you
so, I
expect,
guess we.
yeah, am I
Sir,
audible?
sorry. Yeah, so we lost you for 20 to 15 to 20 seconds. So, can you just re answer that question?
Yeah, so I wanted to say that all meshes they reduce by 10 to 15% in duration of time. So whenever we are doing a inguinal hernia surgery laparoscopic, we are putting a big mesh, which is about the size of 15 centimeters into 12 centimeters, so that it covers all the potential defects, the direct defect, the indirect defect, as well as the femoral defect. So that even if there is a post-operative shrinkage, these defects are well covered and there is no post-operative recurrence. Although if the mesh, if it shrinks in size, there can be recurrence in the inguinal hernia.
Thank you, sir. And the last question that we have in our chat box is, sir, good evening, good day, sir. I undergo appendicitis surgery a week back. Times I do have stomach pain and pain at my waist, but I don't know the cause of this, and it always gives me sleep night and makes me uncomfortable. Please talk. What's the cause of this?
She having a week back.
Yes,
Basically,
sir.
after mastectomy, maybe the wrist pain is not caused by the appendectomy. The pain may be in the operation we insert the cannula also. So maybe the pain by this also, and the pain at the wrist and the maybe the pain is not due to the appendix, because uh, she having the only pain on the wrist and the back. Maybe the reason other than the appendectomy.
Okay, so Dr. Rajat, you want to continue further, sir?
Yeah, so regarding this last question, appendicitis a week back, 1 week is too early. You can have some post-operative pain and some discomfort because obviously it is a major surgery and some sort of discomfort can be there, but you don't worry, it will resolve with time. So you have to give it some time for a week or two to resolve and it will resolve. So you have to have some good analgesics and this pain will go away. You don't worry.
Thank you, sir. So, any take-home message from both of you, sir, Dr. Rajat?
Yeah, so take home message from my side is that minimally invasive surgery has come up in a very big way in general surgery and it has a lot of potential and many patients, who are benefited, cannot be benefited by open surgery are benefited by minimally invasive surgery. And we at Metro Hospital are doing all kinds of minimally invasive surgery, both in laparoscopy and thoracoscopic surgeries. So this is the take home message from me.
So, Dr. Adesh, from your side, sir?
Basically, minimal invasive surgeries are very good at that time because of the patient, all the patient office work and also early reception of work with the minimal invasive surgeries are good. And when the patient having any symptoms like gallstone symptoms or a hernia symptoms, we prefer to come visit in a metro hospital. We do counsel, we examine and do all the investigation regarding the anesthesia, and we assure to go back home as soon as possible with a good effort.
Thank you, sir. And so, as we wrap up this live session on general surgery, and we extend our gratitude to the panelists, Dr. Rajat Saxena and Dr. Adarsh Kumar Chauhan,
Thank you
for
so much.
sharing their expertise and insights. So, and we have explored the remarkable benefits and advancements in minimally invasive procedures, witnessing how they have transformed the field of general surgery. From smaller incisions to faster recovery times, these techniques have revolutionized surgical interventions, improving better patient outcomes and quality of life. We hope this session has sparked your curiosity and encouraged further exploration of the possibilities offered by minimal invasive procedures. So, we extend our gratitude to the panelists for their valuable contribution and would like to thank you, our engaged viewers, for joining us today and actively participating in this discussion. By staying informed and embracing the future of minimally invasive surgery, together we can strive for better healthcare outcomes and a brighter tomorrow. So, thank you for being a part of this session. Take care and stay healthy. Thank you. Goodbye.
Thank you so much.
Thank you.
Thank you.